I'm Holly Schillewert, and I came here for peripheral neuropathy, and I had one treatment so far, and noticed the next evening that while sitting and relaxing.
What treatment did you have so far?
I had mudding done, QNRT, and one PMF.
Okay.
And I was sitting relaxing. Usually about that time of the night I start to feel a little restless leg. My neuropathy starts to bother me, and it's just hard to sit and relax without just like laying down, which I don't like to just do that. But and all of a sudden I had been sitting for quite a while and realized I haven't had any of that tonight. So that was very promising.
Yeah, very promising and very unusual, right?
Yes. Yeah.
And so you're like, what did you think? You're like,
I was like, I think this is going to work. I think this is going to work.
Absolutely. All right. Well, thank you. And this is Holly, and she just wanted to add something about the peripheral neuropathy and how things usually go.
Yes. What I forgot to mention was I have a horse, and when I'm out working with her, I'm wearing big, heavy winter boots this time of year. And we're in an indoor arena where the ground is very uneven. It's hard to walk, which really bothers my feet with my neuropathy and the cold and all of that. So by the time I get home, and just to walk in just stocking feet is kind of painful. And by the time I go to bed, it's really bothersome, and my feet are really twitchy and achy and spasmy, and it just hurts. And when I went to bed last night, I didn't have any of that.
Yeah.
So,
and that's all after your first treatment.
that was after my first treatment, yes.
Wonderful.
Hi, my name is Nancy. I originally came to see Dr. Robert because I have neuropathy in my feet, in my fingertips, and it's because of chemotherapy. I have been getting better all the time. The neuropathy in my fingertips is gone. My feet are great. I couldn't cross stitch before. I had trouble with doing things like that. And I love to walk, couldn't walk very far. And that is getting better all the time.
Yeah. And so anyone who has chemo-induced neuropathy, is it possible to find solutions that would help them heal?
Okay, go. Are we still going?
Yeah.
So anybody who has neuropathy, I would highly recommend coming here because it really is helpful. And it really does improve your life.
Yeah. And I think one of the things that when you first came in, I told you neuropathy is the toughest.
You did.
By far.
You did.
I said there's no guarantees because it is that difficult. Thankfully, in your case, that now you're able to walk, and we're able to get rid of the.
Yes.
Your body's able to heal that neuropathy in your fingers.
Yes.
So.
I'm a happy camper.
Man, blows my mind. So cool. All right, well, thank you for sharing.
Introduce yourself.
Hi, I'm Pat. I suffered a stroke 3 months ago. I've been in physical therapy ever since, but it's going slowly with my recovery. So I came to see Dr. Robert to see if we could speed it up. And today he did a session on me.
First session, correct?
First session. And I had trouble with raising my left arm to match my right arm. And now I have no trouble at all. It's not an effort at all. It was a big effort before.
And even this morning, it was a big effort.
Yes, this morning before I came here.
And what?
My whole left side has been weak, and I've been walking without a cane, but my left leg really needed help. I felt like I was hobbling. And now after the session, it's just walking evenly, the same strength as the right leg. So.
Yeah. So your left arm and left leg were very, very weak.
Very weak.
And now, just after the first session.
First session, and they're much stronger, both of them.
Yeah. So.
They feel normal.
Yeah. That's cool, right?
Yeah.
Well, very good. Well, thank you for sharing.
I'm Carol, and I came in here for trigeminal neuralgia, and it's been probably a couple months now, and I'm in zero pain now. From my whole face is fine.
No pain?
No pain.
No pain.
Yep. And my neck, I had some other issues around my neck area behind my ear and stuff, and that's, yeah, pretty much everything's just to zero
Yeah.
pain-wise.
That neck pain, how many years have you probably
I probably
experienced
had
it?
neck pain for at least probably 3, 4, 5 years.
Yeah.
Yeah,
And now it's gone.
it's gone.
And trigeminal neuralgia's gone.
Yep, yep,
Well, hallelujah, right?
yep.
All right, hallelujah. So
Yep.
thank you for sharing.
My name is Angie. I suffer from myalgia parasinetica, which is kind of a numbness, kind of painful nerve in my left thigh. It hurts really bad to have anything touching it, light touches. It's hard to wear clothing, and just walking around, standing, moving.
How intense is it really in your
it's-
daily life?
It's very intense. I have a hard time working. I can't stand for very long. I can't sit for very long. I can't sleep very well. I don't sleep in my own bed.
Wow.
Because I can't get comfortable. I'm moving constantly because I can't have sheets touching me, blankets touching me. So I usually sleep on the couch.
You know, how do you have to adapt your life for nothing touching you?
I have a couple pair of shorts. I've cut the sides of my leg out so I don't have anything touching my leg. So I
Because
can.
that would bring you great.
Yeah, it gives me some relief then throughout my day. But since I've been here,
How long have you had it?
I've actually had this for about 5 years. I actually have neuropathy in my feet also. That I probably have had for longer, but I'm starting to get some relief now. I've been here, this is going to be my 3rd visit, and I actually slept in my own bed last night.
First time in how long?
For, oh gosh, first time I've slept in my bed probably in a good 6 months. I've tried before and then I've had to get up and leave my bed, but I've actually slept in my bed last night for 5 hours.
And is that a difference than before?
Oh gosh, yeah. Difference from before. I actually had blankets on me. It was a relief. It was awesome.
So you're able to sleep with blankets even touching you?
Yes, touching me.
Wow.
And my feet are starting to feel better, so it doesn't hurt as bad to walk. Yeah, and so
All this in your 3rd?
Yep,
Second,
yep.
2 visits prior.
2 visits prior, yeah.
Yeah.
Yeah, so I'm really excited to see what else is to come.
Right.
So this was actually my last stop for trying to find help. I have tried everything. I've tried every sort of doctor you could possibly think of, and I didn't know where else to go, and I would definitely, this would be the place to be.
And you found that are you reducing any of your medications because of
Yes,
pain
I
is
started to try to
reduced?
reduce some of my medications because I've found some of the side effects that I have from them, and I don't want to be on any medications anymore. So my hope is to get off of all of them and be, pain-free and also medication-free.
If anyone else has neuropathy, any words of advice to them?
Yeah, I would definitely come to functional medicine. I wouldn't over-medicate for sure because I thought that was the way to go, and it definitely is not. It's definitely, this is the place to be. I cannot believe the relief that I've started to get after just 2 visits.
Yeah, pretty incredible.
Yes, it is.
So, all right, well, thank you for sharing.
My name is Connie.
What
And
brought
I
you
came
in?
to see the doctor for mainly neuropathy and diabetic issues. My feet have been getting progressively more numb over the years, couple of years, and I sort of ignored it. My endocrinologist didn't deal with it, couldn't deal with it, so I was afraid it was going to go up my leg, and I didn't want to lose my leg. So now my blood sugars are kind of evening out. I was 97 this morning, which is hallelujah.
Hallelujah, because before starting, the regular in the morning would be what? What numbers?
Could be 200, could be 150.
Yeah.
Could be a low because I had a low during the night and didn't know it, so it could fluctuate.
It's all over the
greatly.
place. And have you noticed that stabilize?
More so.
More so, yeah.
More stable.
Yep. And how about your feet? What have you noticed different now that we've worked here with neuropathy in your feet? What are you noticing? What improvements have you noticed?
I can feel texture. I can feel temperature. And like I told you, I could feel that little kernel of something on a rug, and it could have been embedded in it. But there was like a little something or t'other.
But that's been a couple of years at least that you've had any of that feeling.
Correct.
That's correct. Okay. Well, that's amazing because it's been just a few short weeks.
Well, a couple months, I think, isn't it?
Mm-mm.
No?
No, about five weeks.
5 weeks?
Yeah.
How time?
Very good. All right. But anyway, that's amazing because you've had this for a really long time, right? So, well, thanks for sharing.
Laura Otis, and I'm 55 years old. I'm a grandmother of 11 children, 11 grandchildren, and I have a lot to live for. And before I came here, I had had a stroke 15 years ago, and I had recovered from that through natural medicine. And then I had a heart attack a year ago last July. And then I had another one in November caused by the doctors giving me too many medications. And so I had gone to cardio rehab, and little by little the nurses had taught me that my life was never going to get better, that this was my new reality, that my heart working at 40 to 50% was never going to get better.
What was your life like on a daily basis before coming in?
I was certified disabled because my heart was so slow in pumping my blood properly that I had no energy at all. I could walk across the room and that's it. Yeah.
That's what it was like daily.
It was like that daily. I didn't tell a lot of people. I had to have a paraprofessional come in and help clean my house because I couldn't clean my own house. I couldn't drive because I didn't have enough energy to drive more than 10 minutes. And it was a daily thing where I was so fatigued that going up the stairs would cause me to have to go take a nap because I was so tired. And it's hard to even talk about it. And since I've been coming here, my vascular system has improved. My heart function, I know, has improved. I have energy to go walk around the block now. I can walk for 20 minutes and not stop. And
So not just up the stairs, not across the room, but you're walking for 20 minutes now.
Yeah, I'm walking for 20 minutes and I can run up the stairs.
And run up the stairs.
I mean, I get winded when I get to the top, but I can do it, and I can cook a meal, and I hadn't cooked for a year, and I can go with my husband up to see my grandchildren in Sartell, because even driving very far with somebody driving me exhausted me before, and now I can go and play with my grandkids. And I was in an emergency situation this weekend that would have sent me to the hospital or given me another heart attack, and I was strong and I was resilient and I didn't pass out and I didn't have a panic attack. All these things, you know, from having a heart that didn't function properly, that would send you reeling. I didn't have those problems suddenly. And so I feel strong, I feel healthy, I feel like I'm filled with hope. Because I was, you know, kind of conditioned by the nurses and the doctors that there was no hope, that this was not going to improve. And
so what would you say to anyone else who's gone through similar things?
There's always hope. There is always hope, and there's healing. You can heal from anything. And I'm proof of that. I'm living proof that you can heal from heart failure and a heart attack and a stroke. And, you know, you guys really helped me with the leftover garbage that happened from my stroke 16 years ago. Because that only healed to a point 2. And now my thinking is so much clearer. I'm a life coach, and I had gotten to the point where I could only have 2 clients, and now I'm like, I can help more people because I can think clearly. So it wasn't just my heart you guys worked on, it was my brain and my jaw for my sleep apnea. Oh my gosh, that's huge. That's ongoing. But I can feel that that's improving as well. So you guys are awesome.
Yeah. Where would you see yourself if, like, it's been probably 5 weeks, let's say. Does that sound right?
Yeah.
If you hadn't done this, where do you think you'd still be? Do you think there'd been a change?
I actually, before I came to you guys, I felt like I was dying. I really literally felt like I was circling the drain. And that's the only way I can describe it. And so I would have been at home, not going anywhere, not enjoying my grandchildren, not being able to have dreams again. I mean, we all need to dream. We all need to hope. And I feel like I can go on a trip now, maybe. And before I thought, I'm never going to get to New Zealand again. I'm never going to go do these fun things again. And now I'm like, I can do these things as I get stronger and stronger.
Wow.
I'm not going backwards.
No.
So.
Yeah. Well, I hope it gives somebody else hope who's been suffering similar issues. So.
Yeah.
Well, thank you. Yeah. Thanks for sharing.
Hi,
Thank you.
I'm Carol, and I came in about 3 weeks ago, and I've been diagnosed with trigeminal neuralgia about probably close to 4 months ago. And so I started the treatment, and it's been going really well. And now I've been here, it's my 3rd week, and I'm having considerably less pain. And it feels like it's trying to trigger up, but it's just kind of staying at bay. So I'm having a little bit of pain, but like hardly at all. It's a little bit in the neck area and behind the ear.
Yeah.
But,
before, what was it like before? Like, how many episodes would you have daily? How many?
I would have probably anywhere from 10 to 30 a day when I first started.
And what severity were they?
Oh, it was a good 10 plus.
Yeah.
Yeah, it was extremely painful.
So now, after the beginning of your 3rd week today, you've noticed, what's the change now?
The change is incredible. Yeah, my pain is down to probably 3s when it comes on. Yeah.
Wow.
And it's short spurts compared to even what it was before.
How many episodes a day would you say you've been having the last few days?
Like today now at work, I was had maybe 6 spurts today.
Okay.
Yeah.
But there were 3s?
Yeah.
And where would they be?
They were mostly just more in the lower ear part here.
Okay.
A little bit in the lower head, but
yeah, not where it used to be.
Nothing that went up.
Yeah, not where it used to be.
Yeah.
So, well, very good. Are you encouraged by what you're seeing here?
Absolutely. Yeah.
What do you find each time that you get treated? What do you notice happen?
I get afterwards, and at first maybe I'm a little sore from the actual treatment, but then by that evening, next day, I'm just about pain free, and it's just like total relief. Yeah.
Very good.
Yeah.
All right.
So I couldn't be happier.
Yeah. Well, thank you for sharing.
Yep.
Hi, my name is Lynn Melhop, and I came in to see Dr. Robert because I had a burning mouth syndrome type of thing where my tongue and my lips would burn, and this had been happening for 6 to 8 weeks. Prior to that, I had a autoimmune disease going on, and I just didn't know where this burning mouth thing was going to be taking me, and I wanted to nip it. So I came in to see Dr. Roberts, and after my treatments with Dr. Roberts, I'm about 90% there and doing really well.
Before coming in, the burning was constant, right?
Yep, the burning of my tongue and my lips, it was becoming pretty constant, and so it seemed like it wasn't necessarily food related, or it could have been, but it was a constant thing throughout the day. So even when I wasn't, triggering with food or drink, it was still happening. Yeah.
Are you noticing it daily now?
Really, I am not not noticing it daily, there's a few things that will trigger it that Dr. Roberts has identified. But otherwise, if I stay away from dairy, for instance, and not all dairy, but certain dairies, I'm pretty good. I can go through a day without even noticing that I had this problem.
Nice. All right. Anything I want to add at all? Are you good?
No, I'm good.
I am Paul, and this first day at Dr. DeYoung's chiropractic office, and I'm in for an eye problem and a swallowing problem. My eye problem is I see like a hair or something in my left side of my eye when there's really nothing there. I feel a slight pulling on the eye, and in the morning, especially when I'm looking to the left, I see flashes of light. And went to the eye doctor, and they didn't really have anything that they could do. And there wasn't a issue with the retina yet, but he said some of that's normal part of aging, and hopefully it'll go away in a few months.
Yeah.
And it's gotten better, but I'm glad I'm here.
Yeah.
And
Well, we'll see if you notice a difference with what you've been dealing with. So.
okay. And my swallowing, it seems like I have a smaller esophagus. I have to take smaller bites. Have been having to do that my whole life, basically. And then stressful because, sometimes, my whole family, especially on my mom's side, they always choke. And so, and then just about a year ago, I had an esophageal spasm, which is just, I had ate a little piece of jalapeno salsa, and it just closed up on me involuntarily. Couldn't breathe at all. Very traumatic. And that went away in a few seconds, so I'm very thankful for that.
Yeah.
But very traumatic, and called the nurse line, and they explained it as an esophageal spasm.
Mm-hmm.
And they just advised me to stay away from the trigger foods. And I go, well, how do you know what the trigger foods are? Don't really know.
All right. Well, thanks for sharing. That helps a lot.
I'm Melissa Good, and I've been coming to the Functional Medicine of Buffalo for about 3 weeks now. When I walked in, I was a hot mess, as Dr. Robert knows. Most of the days now, I have fairly good days. I maybe have one day every couple of weeks that's still in that pain zone. I had one the other day, and then the very next day, Dr. Robert had Alex do microcurrent and another massage on me on my limbs. So yeah, it's really nice that they're just staying on top of everything here and super accommodating and kind of just changing plans as you need to go.
How's the pain level been most of the time? What kind of...
Yep, most of the time the pain is probably in the 3s or 4s. Occasionally it gets to that 8. That's pretty rare now. And then...
How's the muscles, the legs before and after? What's the difference in feel now?
Yep, so when I first came in, I'd experienced off and on numbness and tons of tingling. Now I'm not really getting any numbness at all. It's mostly just tingling, and then the body aches. But again, it's not that pain of 10 that I was having almost every day for hours and at night.
Yeah, and that's down to the 3?
Yep, down to the 3 or 4.
Excellent. Okay, well good. Thank you for the update.
Yep, thank you. My name is Melissa, and I am 35. About 2.5 months ago, it'd be early July, I started having some tingling in my feet. And so I went to my primary care provider, who started me on gabapentin for a couple of weeks. A couple weeks later, the tingling started in my hands. And then a couple weeks after that, it progressed to my buttocks, where it was just tingling. And then about the end of August, it started in my neck and my face. It was just like tingling and just like skull crushing pain. When I close my eyelids, they twitch. When I stick my tongue out, it tingles. When I close my jaw, my teeth will chatter, and my whole face feels like it's going like that constantly. From there, my doctors took me off gabapentin because it wasn't doing anything, and put me on Cymbalta and Lyrica, which I've been on for about 8 weeks now. And August was honestly hell. I went to a rheumatologist.
When you say hell, why was it hell?
Just like living in my body was miserable. I went from being perfectly fine, never having a health issue, headache, nothing in my life, maybe taking Tylenol once every 5 years, to spending every single night crying for like hours and hours and screaming, going to multiple ERs. I've been to about 9 ERs just begging for pain relief.
What kind of pain levels was that?
A 10. So I'd be up pretty much all night. I'd live off maybe a couple hours of sleep every 72 hours. And it was literally just curling in a ball, screaming, going to ERs. And if I wasn't in the ER, it was literally just thinking about suicide every minute of every day. And I've never thought about that in my life. I have a beautiful 4-year-old girl. I have an amazing husband. And I was going to leave all of it because of the pain, and I couldn't get rid of it. So in August, though, I saw tons of specialists. I saw a rheumatologist. They did all of the blood work. All of that came back normal. I was referred to a neurologist who did the EMG of my feet and my legs, my hands and my arms, came back normal. So they did a skin biopsy of my lower leg, and up here, that came back normal. I had 2 MRIs of my brain, and cervical MRI. The U of M did a spinal tap. They also did a CT scan of my chest, and everything's still coming back normal. I've had multiple theories or speculations of what it could be. My neurologist said it's mild small fiber neuropathy, but again, that test came back negative, and this isn't mild, it's head to toe. And the things I'm telling the neurologist, he's telling me, are not even symptoms of small fiber neuropathy. Another speculation is I was 5 weeks postpartum as a surrogate when this all started. But that's speculation because I had my own child and I had no issues with that pregnancy. I did get the COVID vaccine in March and April, and that's another theory, is it could be related to the vaccine. But I've heard it's not, because it's typically happens days or weeks after, and mine started months after. So again, it's all speculation just because all of my tests have come back normal.
They don't know. All things are normal. And
right.
Were they able to rule out Guillain-Barré syndrome?
Yeah, with the spinal tap, they feel it's not that.
So there's just no...
So kind of what I was left with is just increasing my dosage of Lyrica and Cymbalta, which haven't been helping anyways. And literally, I was just giving up on life. And then a coworker of mine saw a former friend from high school saw my post on Facebook about what I've been going through, and she suggested coming to the Functional Medicine Center in Buffalo. I started there probably about a week and a half ago, and right away, like, they started with all of the treatments that they have available. I did pellet therapy, the microcurrent, adjustments with Dr. Robert, PMF. I've been doing it hardcore about a week and a half. And since then, this weekend was the first weekend that I've slept without any type of sleep aids. All I took was my Lyrica, did not take my Trazodone that I've been taking for a month.
And the 10 out of 10 pain went down to what?
A 10 out of 10 pain went down to about a 3 or 4.
Enough that you could sleep?
Right, yep, enough that I can sleep. Like, I'm still uncomfortable, but I'm not in pain. Yesterday I went to like an apple orchard with my daughter all day, and I was able to do all the activities with her. And I haven't been able to do anything like that since July.
And what's the date today?
And today is October 4th.
So a long time
Yes.
being in pain, and that just was debilitating.
And it makes you crazy. Like, it literally makes you think of thoughts you never thought you would think, and you just want to give up. When people are just telling you all they can do is increase your prescriptions, and that this is a progressive disease that they don't know what it is, and they can't stop it.
All negative blood tests, there's nothing showing anything.
Nothing showing anything.
So in my experience, I've never seen this specifically when there's nothing to point to, no diagnosis, no positive blood tests.
Right, and I've spent multiple nights at the U of M ER last week, and I spent 2 nights there for 48 hours. An entire team of rheumatologists and neurologists came to my hospital room from the campus across the street to speak with me, and it's all just speculation still. Everything came back to normal, and they have no other tests to run.
Yeah. So I'm just wondering, have you feel a glimmer of hope from what it's been?
Yes.
Speak to that.
Yeah, just like getting sleep alone, you don't realize like how much that affects your life, but literally just sleeping makes you feel like a normal person. Being able to do simple things like going to a movie with my daughter, going to an apple orchard, like it's just hope that I didn't have, because literally my whole life has just been doctor's appointments and laying in bed for 2 months straight.
Yeah. So if you're to speak to somebody out there who has similar no hope, I don't know, what advice would you give them?
Yeah. I mean, when you're in the thick of it like that, honestly, I totally get why you have no hope. But try everything. I mean, there's something out there. Try functional medicine. Try Dr. Robert if you live near Buffalo. I mean, you got nothing to lose. It definitely won't get any worse. It could only get better.
Yeah. Well, thank you for sharing.
Yep.
Hi, my name is Mandy, and I have had issues with swallowing any type of pill for the last 2 years, including an Advil. Gone to different specialists in ENT, and after a few treatments, I'm able to swallow pills without.
What was it like? You know, it's 2 years and you're searching for answers. Did you get answers right away?
I did not. I never got answers, ever. I never got any answers at all. I've had just an anxiety over even certain foods. There'll be things I'll avoid. Definitely any type of a pill I don't want to take because I feel it'll be stuck. And now I've been taking pills all the time, all day, and I'm just waiting for the pain, or I'm waiting for myself to. I know I'm feeling healed, but I'm feeling like, is it going to be this pill that I'm going to choke on or not, or get stuck? And it hasn't. I haven't had any issues.
So it's like 2 visits in, you've had 0 issues with swallowing, no feelings of it being stuck in your throat.
No.
So.
Not at all.
And is that pretty amazing?
It's very amazing. Yeah, it's a whole different. Yeah, it's a whole different level. I'm excited to. I'm not excited to get sick, but I'm excited to be able to try new pills if I need them in the future.
And when you say pills, vitamins.
Vitamins, anything. I mean, I just anxiety over any type of pill. Like I said, even Advil I just would have anxiety over. So.
Okay. And how 0 to 100%? How much better is your throat?
Pretty close to 100%. I can't think that it's not. I'm just waiting.
There's been no issues, but I get it.
No issues.
You're still like, well, maybe.
2 years is a long time to be scared about it. So.
Yeah, got it. Well, thank you.
My name is Angela Carlson. I've been coming here for 2.5 weeks, and we've done, I think, 11 QNRTs now, and adjustments every time, so maybe like 5 or 6 adjustments. I am thrilled to say that I can feel my left side of my face. For years, I've had droopiness. I have to do face exercises, like I'll look in the mirror and I will, kind of do this and close my eye, open my eye, just do anything to kind of work my face. But anytime I'm taking a selfie or picture, if I try and smile, it's always lopsided. Even when I try and smile really big and I'm really happy and things like that, it just doesn't. It's just not there. Last Thursday after a session here, I had a session on Wednesday and Thursday night, I noticed my left side of my face, down the center of my face, all around, and then my back of my skull down to my neck. It was just all tingling, and I didn't know what was going on, but slowly, like, the tingling would come and go, and then I realized I could feel my face.
First time in how long, do you think?
Well, for sure, 6.5 years.
Okay.
Like, my sister said that my face has been weird for a long time before that, because she's honest. But I know that when I lost my hearing, I knew things with my face. Like, I thought that was related, but she says it was long before that. But anyways, I can feel my face. I can feel it when I smile. I can feel, like, I can wink. I saw her this morning, my sister, and I winked at her. And she could tell, she could see it. She was blown away. I'm blown away. And I feel better. Like, I feel prettier because I feel like I have a face.
Yeah. And say a little more about that, because like before, now that you can feel, kind of describe the difference before and after when you say I feel prettier.
Yeah, like I mean, I think it was just subconscious, but it just seemed like there wasn't I didn't have movement there. I was really, like, when I would talk to people, I would just try to keep my face kind of still so you wouldn't notice the difference between the 2 sides. And I just feel a lot better. I just know that I have a full face. It's like my brain knows and my body knows, and I know that what I'm doing, I have control over it, and I haven't had that in forever.
Amazing. So, well, thank you for sharing. Yeah.
I came in for shingles. I had it for about a week before I was seen in here, and I went to the doctor because I had pain in my neck and then also burning sensation on top of my head, and then also from there it moved to the bridge of my nose and over my eyebrow. When I went to the doctor, they said, yeah, most likely you probably have the shingles. Here's an antiviral medication, but you're just going to have to wait it out. I'm just going to have to wait it out. And so I came here and I said, nope, I don't want to do that. I know Dr. Robert can help me. So I went and saw him, and he suggested that I do the microcurrent and then also quantum neurology. And so I came in last Wednesday, and I was here for about 3 hours during the microcurrent, and then I had my first quantum neurology.
What did you notice even in the first treatment?
Less stinging. It didn't sting anymore. When shingles, it like burns and stings. So I didn't have that stinging sensation. Also, my neck on the side, my right side, because it affected my right side. When I turned my neck, it hurt really bad. It like shot pain up into my eye. After the first micro session, I didn't have that anymore. It really helped with that because that was really painful, like for my driving and for sleeping, and just having to turn my whole body was very not convenient.
Yeah.
So it really, really helped. So that was my first one, and then I came back on Thursday, and I had another treatment, and that I went from probably feeling halfway healed. After feeling halfway healed up, I was probably at about 85 to 90% healed, and then
Just is a pretty immediate thing you noticed.
Pretty immediate. It was really amazing how just those two different treatments totally just helped me. It's just amazing, the shingles. Cause
this is your third day in.
This is my third day in.
What percentage
and
better
I'm
now?
Probably at, I would say 95% healed up. Like just, even I want to say like 99%. I'm still a little bit itchy on the head, but other than that.
That's the only spot right there.
That's the only spot, like right here. This is basically all healed up. I just have the blemish or whatever, but and above my eyebrow, you know, it didn't really blister hardly anything, and all the stuff on top of my scalp, the shingles have blister, what do you call it, scabbed over, and so they're all healing up. It's just a little itchy, and that's it.
Yeah.
You know, it doesn't sting or burn like it did.
Yeah. Okay. Well, thank you for sharing.
Yeah, thank you.
And I was cleaning my ear with a Q-tip. I injured my ear somehow, and just had a really loud ringing in my ear, bit of a pain. And I did quantumology, and the pain has gone away. The ringing is almost completely gone.
What loudness would you say the ringing was?
The ringing was 5 or 6 out of 10.
Yeah. And it's just a constantly there.
Yeah, just a constant ring, just always right there.
And we spent probably 5 minutes doing quantumology.
Yeah.
And now
10 minutes, yeah.
No better.
Yeah.
Awesome. Very cool. Great results. Thank you.
Yeah, thank you.
My name is Charesse Payne, and I came in about 4 weeks ago with heart palpitations, no sleeping, numbness in my toes and my pinky, really feeling stressed. Now, so it's been 4 weeks, and I don't have any numbness in my fingers, my toes, no heart palpitations or feeling extra skipped beats in my heart. I've been feeling, I dream when I sleep, and I haven't had that for a long time, very long time. I can't remember.
How many years would you say?
Oh gosh, probably, I don't know, probably between 5 and 10.
Long time.
Yeah, long time.
So that tells you about the quality of your sleep you're having?
Yeah,
Does
I
it?
feel, and I feel more calm, like definitely less stressed.
Yeah.
In normal situations before I would probably get really upset, but now I just don't.
Yeah.
So
how's that paid off for your family, for yourself, for your kids? How do you see that?
well, I think they see a change in me, as far as being not so crabby and just feeling better all around.
Yeah.
I think they're happy about it.
Awesome.
Yeah.
Well, thank you for sharing.
Yeah, thanks.
My name's Angie Braun. I came here to see Dr. Robert because I have something called myalgia peritonitic, which is basically just some nerve issues from like my hip to my knee. I couldn't let anybody touch my leg. I had a hard time wearing clothes. Soft touches put me through the roof.
Instead of wearing clothes, what did you do?
I wore a pair of sweat shorts that I slid up the side so that way it wouldn't touch my leg.
She cut her pants up.
Because it hurt extremely bad to have anything touching my leg. I would sleep on the couch because I couldn't sleep in my bed.
How long has that been going on? How many years?
It's been going on for the bed thing for probably a year. I would sleep on and off on the couch because I couldn't have covers touching my leg and I couldn't get comfortable. And so I just didn't want to wake up my husband. So I would just be on the couch. So I wasn't sleeping at night. Maybe a couple hours a night I would get. I'd have like taser-like shocks in my leg, hot poker feelings, burning. Sometimes it actually felt like my skin was ripping. It was just extremely painful. I couldn't keep a job because if I was standing, it would irritate it. If I was sitting too long, it would irritate it. I just was miserable. But now I'm sleeping in my own bed. I have been for, I'd say...
Well, you've been here how long now? About a month?
Well, a month and a half. I was a little bit earlier than Haley. Yeah, a month and a half. And I've probably been sleeping in my bed for a month now. And I'm able to wear normal clothing, which is great. And I don't have the shocking or that other feelings, the poker feeling, the ripping of the skin, all that's better.
And then how has it made a difference with you just around your family?
So she would literally walk around the house in her underwear because we couldn't touch her, we couldn't be by her. Before all of this started happening, we would like snuggle up on the couch and watch movies and all that kind of stuff. And like my mom was my best friend. Like I would spend all my time with her. And once all of this started happening, I like couldn't lay next to her, I couldn't touch her. It was kind of just like a far away hug type of thing. And she was really cranky all the time, understandably. And she just spent a lot of time away from everybody else, and she didn't like want to be a burden. And we would like ask mom to do stuff, and she'd be like, "I can't, it hurts," and it was just really hard for all of us. But now we all sit in the living room together and watch movies, and she has pants on in the house. And, she's a lot happier. She's always laughing. I'll like walk down the stairs and she's talking with my brother and they're both like ninja fighting with each other or something, and like we're actually doing things together, so it's really nice.
Sweet.
Yeah, so I would definitely suggest coming here because I'm extremely happy with the results and how quick Dr. Robert was able to help me, and I will continue to come here and let everybody know what an amazing job he did for me. Thank you.
Thank you.
Yeah, I'm Sharon Patterson. I live in Maple Lake. I've been here for about a month now.
Yeah, it's been about a month. What did you come in with, and how long were you having?
I had progressively less feeling in my left leg, and it was beginning to be starting in my right foot. My big toe on my right foot wasn't functioning. Just a feeling of numbness.
Yeah.
And I had a lot of pain when I first got up in the morning. I'd have headaches. When I'd go to wash my face, I couldn't touch the sides of my jaw, my face, my ears. Severe pain.
How severe would you say?
11 out of over 10.
Over 10, just so excruciating.
Yep, and it worried me because I thought, well, maybe it's that carotid artery thing or whatever, and but Maudie has been working on that, and I'd have to say it's been very painful, but she's worked on it, but now I haven't had any of those pains.
It's gone.
Yeah, it's absolutely
So that 11
gone.
out of 10,
it's
gone.
0, yeah.
Very good. And then
And
how long were you dealing with neuropathy in the feet? How many years?
Oh, at least 15, probably more than that. I had something of a back injury years ago. They said it was in my lower tailbone, and it went from the injury to the numbness in my leg and foot, and I just felt real unsteady on my feet, and let's say I'm 70 plus, so I always worried about falling.
Yeah.
And just...
Have you noticed an increase in steadiness?
Oh yeah, I think I have much better balance now.
Yeah.
And, I still hold on going up and down the stairs. I'm not exactly dancing on the stairs, but
yeah,
I do, feel a little more secure, and just even... Well, now obviously we've got ice to walk on, whatever, too, and
Are you being woken up by the pain anymore?
No, I haven't had any of the muscle cramps, leg cramps at night anymore either, so that disappeared. So.
And so within the last month, a lot of changes happened that you've had for 15 years.
For a month of working with you, yes. It's
pretty amazing, right?
Yes, it is.
All right. Well, thank you for sharing.
Sharon.
Thank you for sharing, Sharon. Introduce yourself.
Okay, I'm Sharon Pedersen. I live in Maple Lake. I've lived around this Wright County for about 35 years.
Yeah. And what brought you in with, what do we have that we...
Well, I definitely have had some numbness in my feet, some dizziness, and...
How long was that dizziness going on, approximately?
For several years, I'm sure. It hasn't gotten any better, and the numbness in my feet hadn't gotten any better. I don't know what I was waiting for, but waiting for a miracle, I guess, right?
Yeah.
But it just my general health has been deteriorating, and obviously I'm not getting any younger, so I thought, let's give it a try, right?
Yeah. So the dizziness, how severe was it? Like, what would happen, and if you try to
I just always would hold on to something. Whenever I had to bend over, I would make sure that I could hold on to something while I was bending. I never actually fell, but there were a lot of times, and I would get kind of queasy just from having my head down and bending to do whatever I was doing.
Yeah, so activities during the day that you'd be weary of, like what kind of things?
Everything from taking care of my pets to doing the laundry to putting my shoes on. I usually would always sit down to put my shoes on. Socks were another problem.
Yeah, and if you'd hang on, but what the feeling was that you'd get out of balance, you would get queasy. And...
Yep, out of balance, or at times if it was extreme, it was the nausea, queasiness, whatever that. Yeah. The spinning of the room.
And since coming in, what changes have you noticed?
Definitely no dizziness when I bend over.
No dizziness bending over, so feeding the pets, doing your laundry.
I haven't discovered any kind of bending that's made me dizzy. So and then of course I had the pain in my jaw, and that's been alleviated.
That pain, the pain was like from 0 to 10 before?
Yes, and that was a biggie.
Yeah. How big?
10.
Yeah.
I really had, you just never knew in the morning if I could even wash my face, because I had
You know, touching anywhere around my ears and my jaw, even with a washcloth, would send severe pain into my ears, and I didn't really know where it was coming from. But
Did anyone?
Marty apparently found out where it was coming from.
Have you heard of trigeminal neuralgia? Did anyone give you that diagnosis, trigeminal?
The TMJ, I was told by a...
I had a stroke 4 months ago, which affected my left side, including my left hand. And it was very weak. I didn't have very strong grasping power. And it hurt. The fingers were so swollen, it would hurt when I tried to close down on my grasp. And through Dr. Robert, he's been working on me for a while.
About
Last few weeks, actually, just all.
Probably 4 weeks.
Yeah, I think so. And I notice I have a lot more flexibility in my fingers that doesn't hurt when I grasp them, and they're less swollen. So.
And how's the strength?
The strength is better. He tested me today, Strength was better.
Awesome.
So I'm making progress.
Very good. Well, thank you for sharing.
I'm Haley. I'm 20 years old, and I had 5 concussions in my high school basketball career. And I was dealing with headaches every day. I was falling asleep but waking up like 10 times a night, taking naps but not actually feeling rested. I couldn't jump without getting dizzy, and I was just kind of feeling miserable every single day. And I tried going to other doctors who just said, like, just rest and stay in the dark, stay off your phone, all that kind of stuff, and it was never helping. And then I came to Dr. Robert, and I'm sleeping all the way through the night now. I'm not waking up at all. I don't have a headache every day, and I can jump and actually do things without feeling dizzy, and I feel normal every day. It's not always feeling like gross or groggy or anything like that.
Okay. And then,
I'm Angie Braun. I am Haley's mom. I decided to bring my daughter here because we have tried a lot of different things, and the therapy that they wanted her to do was going to be about 9 months long, and she was going to be leaving the state soon, so I decided to try something different and bring her here to see if we could get a quicker recovery. And it's happened.
How long? How long
I've been here
I've been here
2 months.
I think I started in November, and then today's my last day, so about a month.
About a month.
That's right, a month.
1 month. But how long before you noticed real changes in your life?
After like my first thing of mudding was completely done, I did not have a headache every day. And then after we worked on, so that was probably like a week.
So we say mudding, but that's like fixing interference, those old physical traumas.
Yeah, so that was like a week, I think. And that was getting rid of all of my headaches pretty much. And then once we started doing the QNRTs and the QNs, I didn't really have anything.
Nothing.
So I'd say like 2 weeks.
2 weeks, you got rid of all of that. How many years were you suffering with this?
Like every day, probably like 2 years.
Yeah.
And I've noticed that she's not napping as much at all. She seems happier. Yeah, she's a different person.
Why would you want others to come here if they've had concussions?
I would want others to come here because if there's a way that you can get results faster, I'd do it, because it's hard to watch somebody who has concussions go through this daily and not feel good daily, and just, it's just hard on others around them and them. And so I would suggest doing it so there's no more, the suffering is just, it's unbearable sometimes. So I would definitely take a route that's more natural and quicker.
Hi, I'm Audrey Taylor, and about 2 weeks ago I got a concussion in basketball, got hit on the side of my face, and since then I had like really bad headaches, like pounding headaches, and was nauseous and light sensitivity, and I couldn't do homework, and now I like don't have any headaches or light sensitivity or any of that anymore from doing QNs and mudding and QNRT. And yeah.
One day after the mudding, she woke up without a headache. So,
and I slept through the night.
And
I
she,
wasn't
yeah,
sleeping
that's
through the night
right.
either.
Yep.
Yeah.
She slept through
For
the
a
night.
week, you weren't sleeping through
No,
the night.
I'd like never like not sleep through the night, and then after I got hit, I was like, oh, I'm up at 2 in the morning. Yeah.
Yeah, so it worked, and we're really happy.
Yeah.
It's nice to, and school's happy because she can get back to her homework.
Yeah.
All right. So I guess, you know, if you had to say what was most significant, I guess what you noticed, I think it sounds like the mudding made a huge difference.
Yeah,
and
I
QNs
thought so.
and
Yeah.
well, kind of all of it together, but
Yeah, I'd
Yeah.
say the mudding and maybe the QN, is that what
Yeah.
we did
Yeah.
in here? It
Yeah.
was that day doing both, that
Yeah.
we saw a big difference.
yeah,
Mm-hmm.
very cool.
The next morning, yeah.
Okay, well, thank you for sharing.
Thank you.
Awesome.
Okay, my name is Leanne, and back in 1996, I had a tumor removed from my lung that was pressing against my spine. And after that, I had left side nerve damage and pain like you wouldn't believe, up to a level 9, sometimes maybe a 10.
Where at? Where is it pain at?
Mostly, it started mostly on my left side, and then it kind of turned into arthritis, and then my knees were an issue. That's probably been 5-6 years. My knees were probably at a 9 a lot of times.
Mm-hmm.
My right hip was bad, I'm sure, because I wasn't walking straight. I knew I wasn't walking straight, but I couldn't walk straight.
What kind of pain was there?
My bad pain in my right hip, just a stabbing pain probably for the last 5 years. I got I should back up. After the surgery.
Well, prior to surgery, did you have any of those pains?
I
at
had
all?
no pain at all prior to surgery. After surgery, I quit sleeping. I had pain.
When you say quit sleeping, what was the sleep pattern like?
I sleep an hour at a time, from recliner to bed, back and forth. I couldn't stay in any one position for more than an hour.
Okay, and that went on for 20 years?
Yeah, since 1996.
Okay.
Slept the first 5 months in the recliner. It was awful. So I started getting really desperate, didn't know what to do. And so I was told I needed for sure 1 knee replacement, but I didn't want to do that. And so I ran across an ad on Facebook for Dr. Robert for a consultation and an alternative to knee replacement surgery. And so I went. Everything made total sense to me. So I started going. I've been going since end of November, I think. And I'm virtually close to being pain-free. My neck, there's limited movement in my neck, but I have no pain in my neck.
Prior to coming, the pain in your neck was what, out of 10?
Probably 6, 7.
And that's gone now?
I have no pain in my neck.
No pain in your neck. How about your knees?
My knees are good right now. They get fatigued frequently, but I don't have any pain in my knees.
Yeah. And your right hip?
My right hip is pain-free.
Yeah. Amazing, right?
It's amazing.
Did you ever expect that we'd have this kind of result when you started?
I was hopeful, but no, I didn't.
Right.
But I was desperate.
Yeah. And so it's any advice to people who've been suffering it's been 24 years, right?
Yes.
With a lot of the things?
Yes.
Since that surgery.
And also, in addition, I might add, I had a spinal cord stimulator implanted for the nerve damage pain from the surgery. And although that did help some, it kind of moved around in my epidural space, and they couldn't get it back to the place it needed to be, so I had to have it removed. So that was that was my only hope.
And what did the surgeon say to you when
all
those problems were created?
When I had the left side nerve damage to the point where I couldn't rest my arm on a table. It was so painful. So they sent me to a neurologist, And he said, well, you know, sometimes it takes a while for nerves to regenerate and all this. So this went on for 3 months. Went back 3 different times. He said, give it a little more time. I'd go back. It was the same. So I said, so there's nothing you can do? And he said, well, about the only thing that we could do is do the same surgery on the right side as we did on the left side to mimic the pain on your right side to offset it. I don't know if that makes any sense, but
No,
to
it
try and
doesn't.
offset the pain.
But that's what he said.
That's what he told me. That is what he told me.
Okay. And
I knew that wasn't right.
Are you able to do new things that you hadn't been able to do prior? I think.
Well, I can dry my hair with a blow dryer now.
You weren't able to do that.
No, for a
how
long time.
Yeah.
Years.
Yeah.
I mean, I could hold it here and that's about it.
Yeah. So that's a nice.
But I can.
Hey, look at that. So.
I love it.
All right. I love it too. That's so cool. So, well, thank you for sharing. Anything you'd like to add? Come to your mind?
Come see Dr. Robert.
Well, thank you. All right. Well, thanks a lot.
Hi, my name is Kristie, and I've been coming here for what I would describe as vertigo and some numbness to my face. It was all within the neck area that was really bothering me, and I had been seeing a chiropractor for a long time, not getting any results or any relief with that vertigo.
How long did you have the vertigo?
I would say about 7 years. And I even originally, when it first hit me, I thought maybe a sinus infection. So I saw a doctor about sinuses, got, you know, medicine for that. Sinus infection went away, vertigo did not.
Yeah.
So again, chiropractor, and just, it was a daily thing for me. Washing my hair in the shower with your eyes closed, it made it really bad. But when you'd sit up or stand up to start walking, I'd start feeling like I'm walking and leaning, or I'd feel like I'm on a cruise ship, that wave, constant motion.
Yeah.
And just got to the point where I'm like screaming for help. I needed something.
Yeah.
So that's why I saw your guys' ad and I thought, well, I'll give it a try.
Yeah. And what did you find out?
My vertigo's gone.
Vertigo's gone.
That numbness to the face that I had, gone.
Awesome.
So I'm happy.
Yeah. All right. Well, anything else you'd like to say about the treatments that you've had, or, you know, anything? Or other people, like,
functional medicine, you know, a little leery at first. So what is this about? But hey, I'm open-minded. Let's try it, give it a shot. Yeah, it costs money, but so does anything else in life. And I find that I've gotten that relief from coming here.
Yeah. So first time in 7 years.
Yeah.
Awesome. Thank you for sharing.
Yeah, this is Paul Pesky, and just wanted to update you on the condition of my eye. And after 2 treatments, the pulling and tightness is gone, and the flashing is reduced to almost gone. And so that's great. Looking forward to that healing up really nice. And then my hip, it's after 1 treatment, I couldn't believe it, but there's no pain in the hip. And then a little pain moved down into my knee, and we're working on that. But yeah, the hip pain is gone.
Yeah.
And
so
so
how's the knee today?
And the knee is really good. You know, and that's after 2 treatments.
Yeah. So pretty great changes in a short amount of time.
Really good.
All right. Thanks for sharing.
Hi, my name is Anne. I came to Dr. Robert after a referral from friends who have had a lot of success here. And originally I came looking for somebody to help because after my second COVID shot, to me that very day I started having tinnitus. And so that was what drove me to find somebody. And it was really very, very annoying. It wasn't painful, but it was annoying enough that I needed to find something to help. And after an ENT appointment, there was nothing. And it was like at a level 7 or 8 of super annoying. And now it's around a 3. It's not gone, but we're doing a lot of good stuff to.
So in about the last 6 weeks now, I think.
Yes.
You know, and it went from a 7 or 8 now down to
a 3.
Okay.
Yeah, and it's much more. I'm able to integrate it. It's there. Like when I wake up, when I go to sleep, it's there. But it's just so much easier to deal with. And besides that, my overall health,
because of the things they've taught me and suggested with some supplements and a diet. Before that, my gut was very, very uncomfortable, and yet I just thought it was something I just would deal with. I was just very used to a certain level of bloating and gas and whatever, and so with the suggestions here with the diet and the vitamins and supplements, it's like I wake up thinking, this is amazing. It doesn't bother me anymore, very, very occasionally.
And what about other aches and pains all around the body? What have you noticed change on that?
I mean, I just thought it was because of getting older, but I'm gonna be 65 in May 8th, and I feel very energetic and like I'm ready to keep going, and I don't have the joint overall, just like, oh, do I have to live with this kind of thing?
Yeah,
I need to stretch more.
How much did that change in the last month?
Oh, markedly. To just being used to it, to not just forgetting about it.
Yeah.
That it's not a big issue anymore.
Yeah. Cool.
So.
All right.
It's these guys have taught me a lot, and I would highly recommend you.
All right. Cool. Thank you for sharing. Yeah.
Hi, my name is Jane, and I came here to Buffalo because almost 2 years ago, I had a brain hemorrhage in my home in the middle of the night. I don't remember it, but I ended up in the ICU in the Twin Cities for 2 days, and then the regular hospital for 2 days, came home, and I ended up for 3 months having PT, OT, and speech, because when I got home, I could not even say a sentence or walk the length of a room. So over time, I did get a lot better with all of those types of Western medicine things. And then a few months ago, my family let me know that I had become very short-tempered. I wasn't really myself like I used to be before my brain hemorrhage. So I learned about functional medicine and thought, I need to check this out. And I live 30 miles from here in rural Minnesota. And so this was the closest place I could find, because of course I Googled. And I have to tell you that my family, my husband, my kids have all said, oh my gosh, Mom, you are just chill, is the words that they use. I feel so much better. I'm not as reactive, that is for sure. I'm calmer, and I'm eating a lot better. And so that is kind of my story about what has happened to me.
And how's your balance and things?
My balance was okay when I came here. It had much improved from physical therapy and stuff. But as of the 4 weeks I've been here, I think.
Has it been 4 weeks?
3 weeks, 4
3
weeks.
weeks, 4 weeks.
It's improved a lot. And that says a lot, because like I said, it'll be 2 years in April that I had that happen to me. So my balance is improved. Because I'm eating better, I can tell that I just feel better also. And emotionally, I'm a lot better.
Would you comment on like the therapies a little bit? What you think that helped the emotions?
QNRT especially, I would say. I didn't know anything about QNRT until I came here. I know a little bit about emotional stuff because of what I used to do for a living. So I used to teach parents about brain development, brains of their, things going on with the brains of children. But this really connected the dots for me on what has happened to me, and you can still work through your brain to get better. So that's kind of what QNRT means to me. I don't know. Anything else?
No, that's great.
Okay.
So, yeah, thank you for sharing.
You're welcome.
Yeah, cool.
All right.
Hi, I'm Melissa Good, and this is my update about a month after initially coming in here. So today, my pain most days is in the 0 to 2 range. I have about half the time that's still maybe about a 5, 6 with just like body aches, But now I'm not experiencing any more numbness. I don't have any more of the skull crushing face pain. My tongue and my jaw were twitching when I came in here. They're no longer doing that. I don't have any more numbness. I had tingling all the time in my feet when I came in. Now the tingling is off and on. And most days, like, I'm able to do all the activities I want to do. I'm going back to work next week, which I haven't been working for 5 months. And I just came in here with no hope, and I left here with, I feel like a different person, thanks to Dr. Robert. I'm doing physical therapy as well, and they asked what I've been doing, and I told them coming here. I suggest it highly to anybody who's experiencing pain at their wit's end and doesn't know what to do, because I feel like it literally saved my life. Thank you.
Thanks for sharing.
Yeah.